My passion is pink because it is a reminder that I am a breast cancer survivor.
My passion is pink because 1 in 8 women will be diagnosed with breast cancer. We have to find a cure.
I'm passionately pink because I lost my mom, the most important person in my life, to breast cancer in 2009.
My passion is pink because despite African American women having a lower rate of breast cancer than white women, we find ourselves that we have the highest mortality of breast cancer diagnosed.
My name is Lynette Jefferson, and I was diagnosed with stage 2 metastatic breast cancer in 2011. My treatments were completed in 2014. I am a cancer survivor.
Breast cancer is most likely often picked up based off of symptoms, but sometimes that's not always the case. Breast cancer can be found even when there are no symptoms. That's why it's important to be regularly screened. That's with use of a self-breast exam, by seeing your primary care provider, or having a yearly mammogram.
So, what's Central Care Integrated Health Services' role? Well, what we ensure is that when you come into our clinic, you will have a thorough history taken, a thorough physical performed, and after we have assessed your risk, we will get you scheduled for a screening mammogram. Now, if you do not have any insurance coverage or Medicaid, we ensure that you're still able to get that screening mammogram by our collaborations with groups such as the Rose and with the American Cancer Society.
One of the most important things to consider are your risk factors for breast cancer. One of the risk factors for breast cancer specifically is having a family history of it. So it's important to know if someone in your family has. Now, just because you don't have anyone in your family that has breast cancer does not mean that you don't need to be screened. Why? Because history starts somewhere. Please get your breast cancer screening.
The best way to combat, to prevent, and to treat breast cancer is early detection. This is not something that you've got to wait for a huge sign to know that you have it. This is something that if we find anything, especially in the early stages, it's so easily treated. And you may say, I don't want to know. I don't need to know that. I can get over it. There's no reason to intervene. Well, I've got something for you. We always need to know what we're up against. You can't fight an enemy if you don't know who the enemy is. So therefore, if you just think this can't happen to me, then why not? So just come on over, get an exam, know your history. Central Care is here because of you, but more importantly, we're here for you. So all I can say to you is passion is pink, living is life, and life is living life.